Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. I hope you're all well. Before we start, I'd like to share with you some thoughts about my recent absence on this channel. The reason is, for about 2.5 months now, I'm attending a study boot camp, preparing myself for the National Board Exam for Health and Wellness Coaching in May. So fingers and toes crossed, I will pass this exam and I should be back with more regular videos soon. I also seem to have some audio issues since the residential move. I bought a new microphone, but there's always this background noise, so I apologize if you hear it again this time. Probably have to buy a new camera now soon, so I will sort it out. Hang in there with me. So this week, let's take a look at how you can heal gingivitis with natural and effective therapeutic tools. Gingivitis is one of the most common type of gum disease, and it's rare during childhood. Usually starts about puberty, early adulthood, but it can come and go during your lifetime. Statistics say about 70 to 90% of adults in the US have actually gingivitis, which is a lot. And often the cause is this buildup of plaque on your teeth and the gum line. So enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. Thank you so much for your thumbs ups and likes, because they help the growth of my channel. And lastly, have a look at my website medicanova.net at the online academy, where you will find comprehensive certified home study online courses in homeopathy, in mental health, health and wellness coaching, quantum healing, and so much more. So what is gingivitis? It's an inflammation of the gums, and it's classified by how it looks. You know, are the tissues more bluish looking, or red and blue, or purple? Right? There's a discoloration on your gums happening. What's the cause? What's the story behind? And how long it lasts? Is it acute gingivitis or chronic gingivitis? Is it ulcerative? Right? Is there pus involved? Is it hemorrhaging? Do you bleed every time you brush your teeth or floss your teeth? Is this necrotizing? Means the bone structure is affected and decaying. Is it purulent? Is pus involved? Is it drug induced? From medication. Often people with diabetes and heart disease or rheumatoid arthritis also experience gingivitis. Do you have hormonal challenges? Do you have a nutritional deficiency? Right? All of that is part of that. Or is it infectious already? But most people have a long-term case of gingivitis caused by the plaque. And this means that the bacteria isn't really resolved within the mouth. It's not really cleared up. And the bacteria built up over time can therefore start to irritate and inflame the gums. But when plaque and poor hygiene are the problems, the condition also can lead to inflammatory gingival enlargement, or we call it gingival hyperplasia. That means the swelling is now ending up in an overgrowth of the gums. Other types of gingival enlargement can be also caused by medication, right? I mentioned it, or hormone imbalances, or underlying health conditions, or even genetic conditions. So it starts with this mild swelling, but over time it gets worse. It causes lesion, you have maybe pain in the mouth, there's halitosis, a smell comes in, or you even lose your teeth. So from gingivitis, which is this idea that the gums are red, swollen or bleed easily, it can go into periodontal pockets where the plaque begins to form sort of below the gum line, a pocket like a bag, and food can accumulate there, bacteria can sit there even more, and then pus starts to happen. Or periodontitis, which is now the true inflammatory part where the plaque and the tartar really starts to destroy the gum or the bone structure, and you maybe have then wobbly teeth coming up, right? So it can go from mild to worse. So what are the symptoms? Well, it's swollen, puffy gums, tender gums, The discoloration can be from dark red to bluish, even to purple. Receding gums are involved here. And of course the bleeding. Every time you brush your teeth or floss your teeth, you have the bleeding. With it comes the bad breath, the halitosis. But don't ignore these symptoms because, as I said, there can be some underlying health condition happenings like heart disease, diabetes, rheumatoid arthritis. So check that out. What are the causes and the risk factors? I think poor oral hygiene, I would say the top of the list here. Elderly people, anybody about 65 and older. Smokers, if you chew tobacco, I think that's part of it. Genetic risk, yes, I mentioned that, but a low functioning immune system, I would say, comes here very much to mind. If you're under a lot of stress, if you have a nutritional deficiency. Some of you out there maybe have a tendency to clench or grind your teeth in the night. That can be part of it. Or if you have problems with your braces or your dentures and they don't fit very well, so go to your dentist, have an appointment and let it check out. Obesity comes in, I would say, part of it too. So what would be the conventional treatment? You go to your dentist, book an appointment and let's see what he or she can do for you at this point. And I come in with the natural treatments on top of it, and that should work. If you are interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's move on to the second part of this video, food for thought. Metaphysical meaning. As with all of my videos, I want to encourage you to look behind your physical symptomatology. What's the story? Right? With teeth, we often feel like we want to bite into something, like a dog into a bone. There's passion and zest, and we want to get our grit into something. But when the teeth are affected and the gums are affected, there is also the topic or the issue about decision, or not being able to make a decision, being indecisive, or regretting a decision. Right? And that's usually when the teeth start to act up. So I always refer to Jacques Martel references, because he really has a good grip about this. I like to share that with you. He says, an infection in the gums indicates that I'm feeling fear. It may be about myself or a decision I made and now regret, or a decision I have made that I'm calling into question, actually. Or it may be about my indecisiveness in coming to a decision. This fear may also concern another person, maybe my boss, my spouse, even my religion, whose decisions may directly affect me and over which I have no control. Someone has acted too fast, and this irritates me. I feel frustration, I feel dissatisfaction, which could lead to confrontations that may not be necessary. So the upper gums refer to my work or to my role in society. So you can see it's more the male part, the outgoing, the active part. And the lower gums refer more to my receptive side, the emotional part, the female side. So when the gums become inflamed, they express distress and poor self-defense accompanied by this lassitude, melancholy and fear. I learned to channel this fear and express it in order to avoid inflammations in my gums. Now, gingivitis usually involves bleeding in the gums, which indicates sadness or loss of joy of not being able to express myself from saying certain things. I may feel that what I'm saying is not important or won't be listened to. As the gums are the foundations upon my teeth rest, which is truly, really the core of your house, so to say. These foundations are now collapsing and leaving me with a feeling of powerlessness and over life's events or in relation to others. there's usually anger or sadness involved as well. I stamp around and criticize instead of seeing how I could move ahead in my life by leaving the past behind. A feeling of powerlessness is gripping a person affected by expulsive gingivitis, which is characterized now by receding of the gums. So reality is no longer holding fast, and my inner strength is affected by this. My gums are awash in the tears of my teeth, my emotions. So I always ask myself if I made the right decisions. I have difficulty in maintaining my choices. I'm experiencing an extreme duality because I doubt myself. I want so much to be accepted by others that I will be extremely flexible and understanding, but meanwhile, I'm putting aside my own personal needs. So what would be the positive affirmation here? I can take a moment of silence with myself to recover my strengths, right? You can see already this is about empowerment. This is about reining back, what you have given away, or, getting back in your self-efficacy, the belief that you can initiate and maintain change, right? You can make a decision. And you become aware of the fact that each event in my life is there to make me grow, and that any important change is necessary for me to achieve the goals I have set for myself. So I accept my true worth, and I move ahead in life with determination. Right? Really believe in yourself. When you make a decision, you haven't done the wrong thing, you can always change it. But it doesn't mean like your body has to take it on. So if you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at help@medicanova.net for your 3 months coaching program, and I'm coaching you to be well. So what would be the natural treatments? Well, the first step is get yourself antibacterial mouthwash, go to your dentist, and really cultivate sort of a proper dental hygiene at home. I would say externally I would use some salt water to flush out the toxin on a regular basis. Salt water really kills the bacteria. Usually half to 3/4 of a teaspoon of salt mixed with a glass of lukewarm water. Swish it around for 30 seconds in the mouth, spit it out. I would do it 2 to 3 times a day. That helps a lot. Others out in the field would maybe use essential oils like peppermint essential oils or tea tree essential oils, mixing up with a glass of water. That's great as well if you want to do it, but be careful because often it antidotes or doesn't go along with the homeopathic remedies I suggest. They're very sensitive for essential oils, but that would be another useful part here as well. Of course, brush and floss your teeth at least 2 to 3 times a day to make sure that these bacteria they don't sit there. Another great strategy is from the Ayurvedic medicine. It's called coconut oil pulling. You get about a tablespoon of coconut oil and you have it in your mouth first thing in the morning for about 10 to 20 minutes. I know it's a little bit long and you want to get going and you don't have time in the morning, but maybe you have to get up a little bit earlier, for that, because it's really valuable. So have it in your mouth, swish it around for 10 or 20 minutes, and then spit it out and brush your teeth. As it says, it's coconut oil pulling. It pulls out the bacteria. But it's not just great for your mouth, it's also overall well-being and detoxing your body right at the best start of your day, which is a great idea. I talked about nutritional deficiencies. And here, please get yourself a good vitamin and mineral supplements. You want to bring in vitamin A, B complex, D, E, K, magnesium, calcium, iron, and zinc. So all very important here. For external application, I, in the past, recommended to patient use the tea tree oil, but then, as I said, be careful with the homeopathic remedies. Just rub it in on the affected area several times a day. If you don't like that taste, you maybe want to do turmeric gel, aloe vera gel. It cools down the gums quite nice. Neem gel is very good as well, or black cumin gel. Clove is very, in the herbology part, recommended, but has a very strong taste, but that would help as well. Don't forget to switch your diet into an anti-inflammatory diet. You can go on Google, look a little bit around, but basically it's a wholesome diet, including organic, fresh vegetables and fruits, good lean protein. So really flush out these toxins, and of course quit smoking. That doesn't go very well here. Let's move on to the homeopathic remedies. One of my favorite subjects, of course, in my practice. The combination with lifestyle changes, adding supplements and homeopathic remedies is a great combo, because it really meets the individual symptomatology of your gingivitis. Homeopathy can treat gingivitis of both recent and chronic nature. There can be swelling, there can be pain. The bleeding is wonderfully really controlled with these remedies. Homeopathic remedies, if started more well in time, help treat the acute symptoms of gingivitis as well as prevent the complications like periodontitis, for example, which I mentioned at the beginning of this video. They also boost the body's own healing mechanism to eradicate the disease at the root and also prevent reoccurrence. But if you need more help in terms of how to take these remedies and more guidelines, please contact my practice Medica Nova at help@medicanova.net for more guidance, or consult your local homeopath. From my clinical experience, I think the potency 30, which is also the potency you get over the counter in your local health food store, is suggested here, maybe for adults, 1 tablet morning and evening for 1 or 2 weeks, or longer if indicated. Everyone is unique, and there is no one-size-fits-all remedy here. One needs to really take the case, the severity of the situation, and then advise you with the best treatment protocol. I would say there are a few remedies which are on the top of the list in my practice, in my toolbox. One would be Mercurius solubilis. You can get it in your health food store or online. And here the gums are very bluish red, swollen, painful, and tender. Another one is creosote. This you would have to order online. It's also a great remedy where the gums become more bluish. So Mercurius solubilis is still a bit reddish, but now we go into this bluish discoloration with intense swelling. Gums are very puffy and protruding. And the next one, yes, you can get it in your health food store. It's called Carbo vegetabilis. Fantastic remedy, the best remedy for bleeding gums when you brush your teeth. I mean, hemorrhaging, right? Really lots of blood coming out. Fantastic remedy. Another one is Alomen, which is common potash, is considered when the teeth get loose. But here, of course, you need professional help. So let's focus on gingivitis with swollen and painful gums only. And the most effective homeopathic remedies are here: Mercurius solubilis, creosote, and lachesis. Again, with Mercurius solubilis, you find that you have this bluish reddish gum, painful, swollen, spongy. The gums recede also in these cases, usually accompanied by increased salivation in the mouth. Creosote, on the other hand, gingivitis is more, the tissues get more into the bluish discoloration. Again, lots of puffiness, protruding and puffy. But we also have this putrid smell coming up now, right? And lachesis works very well in cases where the gums are then purple in appearance. So it really changes in color. And the person also complains of a sour or peppery taste in the mouth. If your main concern is more bleeding gums, 2 remedies come in mind is phosphorus and carbovegetabilis. Both you get in your health food store. Phosphorus is more indicated when the gums bleed easily. They're sore, they're painful, and that really can be even from exposure to cold or heat, or even after eating or while eating. Whereas a carbovegetable is really about when you brush your teeth, you floss your teeth, and there is just excessive blood coming out, oozing of blood. So it's really, really fantastic remedy here. And if you get to the stages where the gingivitis is affecting your really your bone structure now, when you have tooth decay, we have remedies like thuja and creosote. I mentioned that in the beginning, in the first part of the section of the homeopathic remedies. Creosote is great remedy indicated for tooth decay. Next to the gums affected with gingivitis, the gums are very dark red, retracted, swollen, decayed, and crumbling teeth by them. And also, you have this bitter taste in the mouth, right? So it's like, it really separates itself from the remedy Mercurius solubilis. If the halitosis or the bad smell is a problem for you, of course it is for everyone, but if that's the key symptom, so to say, I would start with Mercurius solubilis, the remedy morning and evening, 1 tablet. Again, with Mercurius solubilis, you have more saliva in the mouth, it's more moist. Creosote, it's more of a sort of bitter taste, whereas with the remedy silicea, you have a dry mouth. It's not like Mercurius solubilis where there's a lot of salivation, but this is a very dry. Often the smell is worse in the morning. And also cold air or cold water worsens the pain in the gums. And then lastly, if your teeth are affected and they start to become loose, they need to be removed, of course, by your dentist by them. But we do have a remedy, calcarea fluor and aloman, which are great remedy when the teeth get loose in the sockets from long-standing gingivitis. And, the teeth don't hold in the structure anymore. I'm not saying homeopathic remedies can, magically, build up the bone structure again. But if you start early, in the early stages, and find out that there's something, happening in that direction, and you take the remedies, you maybe can prevent losing your tooth. Right? That is even a major, benefit here. So I hope that today's video, inspired you to look out and seek out for more natural solutions. As you know, there's always a way. If you're not quite sure about the treatment protocol and how to take this remedy, contact my practice Medica Nova at health@medicanova.net. And again, if you want to learn more about my work, have a look at my website medicanova.net at the online academy, where you will find comprehensive certified home study online courses in homeopathy for the whole family, for example. If you ever wanted to feel like you want to dabble with these remedies and how to help your friends, your loved ones, your children. I also have a course for homeopathy during pregnancy and birth and postnatal care. If you wanted to learn about integrated mental health, what to do with anxiety, depression, Alzheimer's. Or if you want to boost up your skills in health and wellness coaching, I have a course for that as well as a course called Being and Living Quantum Healing, just based on my book, The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. It's really about how to deal with your mind, the body in terms of detoxification, a diet, what helps you here, and your soul and your relationship to your spirit. So there's study material for everyone out there, and I'm happy to guide you and support you here. So till next time, much love. Take care.